Dr. Matt, hi, how are you?
Good, good. Hi, Liz. Good to see you.
Hello. Thank you. You too. So, I just wanted to bring you on here today to chat with you a little bit about these trainings. I know all of our new doctors have seen video after video, and they've heard so many testimonials about how powerful these trainings can be. What can you tell us? I've got a few questions for you, but what can you tell us basically to help our doctors prepare for this training day?
Yeah, to me, this is probably such a great way to introduce this to your community and your practice. And so the main thing I say to doctors is this. Some of them have been in practice for, 20, 30 years. And I say, Doc, they ask me, who do I get for this training day? I say, Doc, you get all those patients who've been so loyal to you over the last 2-3 decades, but still have underlying issues that haven't been solved by conservative care. So they say, oh, okay. And then I want them to start getting that list together. And we want one wrist, one elbow, one shoulder, a couple knees, feet, back, low back, whiplash. They start saying, well, oh yeah, I got Mrs. Smith. She's had 2 carpal tunnel surgeries. She's had bad wrist. Perfect. I've got another guy, Mr. Jones, who's got a bone-on-bone knee. Yeah, perfect. And then Phil Bob has got a low back issue that hasn't been resolved, and it's been there for 10 years. And those are the people we want. The worst in your worst, right?
Yeah.
We want to take other doctors' failures and show them that what we can do with this technology. And again, one visit doesn't fix everything, but it starts that healing process. And I think that's so important. And that's the wow factor that we want to show. And again, as soon as we put down the probe, we want to pick up our phones and get ready to capture whatever comes out of those patients. And again, if it's like, I didn't do so well, we delete it. But 80% of these cases are like so excited. You want to capture that because it's a limbic response in their brain. They're never going to forget it. And
yeah,
I just got off the phone with Dr. Chris Strayas, and he's like, this has been awesome. He was retired, came back to work 2.5 days a week, and he's loving this. And he's working with some tough cases, which is so cool. And we never thought when we were in college that we would be able to help these people in these types of debilitating pain.
Well, and I think, taking video of the entire training day is really helpful to start building those testimonials too for your office. You can use those for ads. You can use those for anything. That being said, would you recommend giving away these treatments on the training day, or do you recommend doing some kind of introductory special?
Bottom line, this is just too valuable to give away. Okay, people have no value on it if you do. We brought this down to a $49 value, so to lower that bar and just allow people to experience this technology. And the coolest thing about this is that within 10 minutes, we know if they're a candidate. There's nothing else in the world like this, because if they come in and we scan through, and this is not the probe, but we scan through an area and we can't find pain or tenderness, then they're not candidates. And you don't even have to offer them a care plan, which is wonderful. But guess what? If we're able to find those tender spots and hot spots as we map that area out, and the more pain and discomfort they have during the treatment, the better clinical outcomes. It's funny, wearing the masks at a lot of these training days, I would tell the people, under this mask, I'm smiling when they were, and they're like, you say this. And I'm like, no. I just know that you're going to have this better outcome. And sure enough, as soon as people get up and they're like, wow, oh, geez. And that's what's so beautiful and why there's such high rate of patient acceptance of your care plan, is because they feel it right there. Even before the end of the treatment, they know that it's getting better because there's less pain. Right? You've done 50, 60 of these trainings.
Yeah, and that's something I talk about all the time. I am not a highly emotional person, and I think I have cried at 9 out of 10 of these trainings because the results these people are getting. And I could kick myself for how many I haven't filmed. So I want to keep stressing, film these reactions, film them before, take pictures before, their range of motion before, mark that, and then get it afterwards.
I've been
Get
lucky
them
enough
as
to
they're
be-
getting off the table.
Yeah, I've been lucky enough to be part of this company for 4.5 years. And I remember when I first started coming home telling my wife, I'm like, honey, you're not gonna believe it. This lady's arthritic hands were able to open and she can now open jars. And she goes, did you videotape it? And I go, no. She goes, hey, nobody's gonna believe it if you don't videotape it. So
It didn't happen if you don't have proof.
I bust our doctor's chops because they're like, you're not gonna believe this and that. I'm like, I use my wife's line, I'm like, no, I don't. Where's the video?
Well, it's a wise lady you have there. We all know that. She's very wise. So let's get to logistics really quick as far as this training. What are some of the supplies that people need to have on hand just to make sure that they're ready to go?
Ultrasound gel, for sure, and paper towels and a trash can close that we can throw them. But sometimes what's great is, obviously you want a private room is great. We've done them in group settings as well, which is really fun. But in the future, doctors should look at a table that elevates so it's not so bad on their back. But again, for the basic ultrasound gel, our device, and fill up patients. And the one thing I got to tell you, we have a patent pending protocol that is soon to be hopefully approved, but it's you give us 10 minutes, we give these patients their life back. This takes 10 minutes to see a new patient. So we block out 15 minutes, 4 per hour. We're there for 3 hours, it's 12 patients. It's beautiful. And you just stay on track. And that's it. It's a 3-hour training. On average, we should collect between $5,000 and $7,000. Now understand, some doctors have had patients that have been in there for a long time and they're on certain care plans. So they're going to add value to that care plan and then add this on. So I understand some doctors don't charge. And again, if they buy the care plan, you can waive the $49.
Well, and that brings me to my next point. Who, as far as staff and the doctor, whose attention do you need on these training days? Who do you expect to be in that room watching and learning?
So, obviously one of the things we love about this, and you got to check your state laws, but we want a chiro assistant, or a massage therapist that works there. We want also to certify them, right? We're handing that baton to the doctor and his therapist, right? We are the experts. We come in, we train you, and literally within, 20 to 40 minutes, people are like, I got this. Yeah, it's not hard. It's very user-friendly.
Right.
So, and that's the hardest thing, is turning this thing on. It's this double click on the blue button. And, I just talked to a doctor yesterday. He was holding it down the whole time. And I'm like, oh, I'm good. No. So, when
he's
you
going to end up treating his thumb so much.
Yeah, it stops on the button. It stops on the number of, predetermined shock waves that you're going to put in there. Any other questions?
I believe that's it. Thank you so much for meeting with me today. I think this is going to help clear up a lot of questions that our doctors have. Any other thoughts you have?
One rule that I always tell patients is, and I make a joke about it, but I say Mrs. Granny Smith, I said, Miss Smith, we have one rule here. And they say, okay, what is it? And I say, no screaming. And they laugh. No, I say, no, if this helps you, all I ask that you tell others. And they're like, oh yeah, I've already got my neighbor Janice that's waiting, and because you're planting the seeds. These patients have been to doctor after doctor after doctor without relief. So if you do help them, they want more, and they're gonna tell people. And we did a survey a couple of years ago at our clinic at ATL Pain Institute, and we realized that each one of our patients told 7 different people about their experience. Wow. But guess how many came in? None.
Not that many.
Not many. So we created this little, and you're great at it too, creating that QR code that it's right on our pamphlet so that we can say, listen, if you know someone that helps them, just have them scan this with their phone, right? Even grandmas know how to do the menus now at restaurants. And then you can send them in for the $49 first initial assessment. And it saves them $100. So, people like that. And sure enough, right after they're done and she's walking around, I can't believe it. I go, don't forget our deal. And she's like, whoa, what was it? I go, you were going to tell others. Oh, okay. So we got to make sure that we're helping, that our patients become ambassadors to our doctors' clinics. And, we send organically 3 to 4 new patients a week from our successes.
Yeah, we got to make sure our patients are spreading the good word.
Yep. All right, Liz, be good. I'll talk to you soon.